So today is March 1st. I am right outside Dr. West's office. I'm in my car right now, just for my 3-month follow-up. So as many of you guys may know, I have still been dealing with some of that stiffness in the front of my knee. And, at this point, 3 months post-op, I thought that, a lot of this would have been gone by now, and I could have been kind of progressively loading to get back to doing stuff like jogging and, jump rope and things like that. But I don't feel comfortable because of the feeling of pressure, I guess, in the front of my knee. I still have 4 range of motion, so I ruled out at least cyclops lesion and any massive scar tissue. But that's at least still the initial thought in my head, that it's still something that's blocking my knee from feeling good right now. So I'm about to walk in just to see if Dr. West has any insight into it, and I have all my stuff to film it, so hopefully it'll be at least informative for you guys, just to see the conversations that we have discussing my knee. So yeah, hope you guys enjoy. At least on my end, still the stuff in the front of the knee. So before, I think the first time I came to see Carrie, it was more tibial tuberosity. That kind of is pretty much gone now, and it kind of shifted medial shin, and it was just skin tightness. It just wouldn't go away. And then after some time, it actually finally started to go away. But I would say probably for maybe 3 to 4 weeks now, I've been dealing with a lot of stiffness in the front of my knee. I still have full range, full flexion extension. Both are still there. But whenever I do any type of, even a quad set, I will still feel just a tugging along here. And then stairs, going up and down stairs, same thing. Even just walking, I'll still feel that, which is why when I initiate my swing through phase, I will still feel something there, which is why I still walk a little funny right now. Yeah. I've obviously ran through all the possible things in my head. I was I don't think it's cyclops. I don't have any loss of extension. Yeah. I don't think it's a big enough scar tissue. I've had athletes who they've been stuck at 125 of knee flexion, and then something's blocking it, yeah. But I don't have that either. But the only thing that I figured out that can actually manipulate any type of sensation is when I take my finger and just really pull my skin. Yeah. And if I do it right now, I feel that right there. Yeah. When I move it, that's more or less 80% gone. That takes some away. Yeah, okay. just doing that. Okay. But I've done anything I can think of. I've cupped it, I've dry needled it, I've done any type of the passive stuff that I don't normally do. Yeah. But just to try and mitigate some of it. I saw my friend on Saturday who sees a lot of ACLs. He dry needled it.
Did you dry needle around the tendon, or
yeah. Yeah, and dry needle with the stem, and then maybe it lasted 15, 20 minutes, and it maybe provided 20% relief. Pretty much as soon as I got home, came right back, and okay. It's been like that the entire time. I can alter it by a little bit, and it will last for not 30 minutes to an hour, and that's it. Yeah. And it'll come right back.
And then and it started a couple weeks ago, so it wasn't before that you had some a little bit. It sounds like tubercle stuff, but now this is something a little different.
Yeah, I think I've always had some I guess stiffness in there. Yeah. I don't feel like I've walked normally since surgery. Yeah. It's always I still think about every step that I take. Mm-hmm. I think the first time, I don't know if it was you or I told Carrie, that when I walk, I felt my knee every once in a while it would buckle once a week. I feel most of that is pretty much gone, but I think part of it is just the apprehension of just wanting to walk normally because of whatever I'm feeling. Yeah.
Okay. Maybe lay down. Do you have a short?
Yeah, I am.
And what's it, 3 months now?
Yeah, 12 weeks.
12 weeks. Okay.
Yeah, 12 and a half weeks.
And what kinds of things are you doing as far as rehab now at this point?
So to be honest, I really have been cognizant of not, because I originally, because it was here, I was is it a tendinopathy thing? Yeah. And then, I was I don't think it's tendinopathy, because normally people don't get that until, 4 or 5 months when they're starting to do running and things like that. And I haven't done any of it.
Have you tried a show pad strap or taping it or anything?
I've tried taping it with kinesio tape. Same thing. It'll give me, the first time I did taping, it felt phenomenal. I was okay, cool, I'm finally onto something. I had a really good rehab session after that, and then I went to sleep, came back, and then nothing. It just went right back to what it is. Yeah.
Did you ever try a show pad or anything?
I am not familiar with that.
Is it a show pad? It's the patellar tendon strap.
I have not yet.
Okay.
I have not yet.
Go ahead and lay all the way back for me. Have you noticed any swelling or anything?
I think I still have a little bit, but yeah, and that was the other thing. I was is it swollen? But all my friends who have looked at it, no one said it looks ridiculously bad or anything.
Yeah. Squeeze your muscle real tight here. Good, squeeze here real tight. Just relax. Right? nice extension.
I think that's why I didn't think it was Cyclops, because, you know, I have full range.
Yeah. Go ahead and bend your knee for me. That body, when you get up into deep flexion, does it feel tight?
A little bit in the back, but nothing like terrible.
Straighten it out. Straighten this way. Just relax here with me. Rock solid. Can I push here, Wesley? Is that sore in there?
Minor, very minor.
A bit here.
Nothing really.
Anything in here when I push in there?
Mm-mm.
You sore here?
No, but that's right there, right where your finger is, exactly where I feel most of the. Yeah.
Sore when I'm pushing on it now?
Minor.
Stand up for me. I should have brought my ultrasound. Scanned it. But go ahead and just do a squat, double leg squat, so I can see you. Try it again. Try single leg on that side.
So that's when I feel it the most. Any type of like single leg.
Where you feel it.
Yeah.
When you feel it. What position?
Right about there. Yeah, and it's like same thing right there. And that was when I started thinking about like a tendinopathy thing.
Yeah,
but then, like, I think the weird part is, like, at least my experience with tendinopathy is, like, you don't feel it just doing a quad set like this, you know?
Sometimes you do. I do see people like that sometimes who get that, you know, get it irritated. You're sore right at that insertion. Go ahead and try single leg again one more time. It's mostly down in lung in here, you'd say?
Yeah.
Kind of that distal patellar tendon. Not as much up in here.
It's almost like it's kind of vague, to be honest, but it's just, I just feel it along this entire area.
Have you tried any anti-inflammatories or done anything else?
I did the Movic that you guys gave me. I finished 2 rounds of that.
Yeah,
and then I also took turmeric for like the whole bottle.
Okay. And when you did the Movic, did it help you?
No.
Didn't do anything. There are a couple things that we could try. I do think it's a tendinopathy. I mean, it's right at that. You can still feel the harvest site. If you put your finger in there, you can feel that little divot in there. You know, that tendon, it actually takes about 3 months to regenerate, and then it has to get strong, right? So now you've got the collagen there, but it's not normalized yet. So I do think that's what it is, honestly.
Okay. And
I've seen it this early. I think there are a couple things we could try. You can sit down here if you want. You know, the needling you could try the needling. I mean, sometimes the needling can help to regenerate some of this stuff too, right?
Yeah.
If you're going to get a little bleeding in that area.
Yeah.
We could try a Chopat strap and see if you like that. We have them here. You could just put it on and see how it feels for you.
Okay.
But it just offloads the area, basically.
Okay.
It's like a counterforce brace. So you can adjust where you want to put it. And sometimes you put it a little bit higher and it will offload that area. So I would use it then for any kind of activity, any kind of single leg squat, so you can start doing that so you can get this going. Does that make sense?
Yeah.
Because it's definitely your BMO still shut down, as you can see, right?
Yeah. I mean, like, I've been doing a lot of BFR, so I'll do like knee extensions. That's pretty much the one thing that'll like really get my quads going.
Yeah.
I'll BFR bike.
Does that bother you when you're?
No, those don't bother me. But as soon as I get into like any type of closed chain,
that's interesting.
Yeah, that's when I'll feel it the most. And I've had like really random pockets of having like good, quote unquote, good rehab days. And most of them have been, weirdly enough, on Sundays. Like, I don't know if it's just like being off my feet on Saturdays, because I don't really leave my house too much on weekends. And then Sundays just feel really good. So most of my good rehab sessions have been actually at my house as opposed to at work.
Yeah.
I've been hesitant to like even put a bar on my back just to like even load heavy for squats, just because I don't want to keep. I don't want to
keep aggravating. I mean, it's this fine line if you want to get it better, but So I think we should try that Chopat and see how you feel. I'll just have her bring it in now, just so you can play around with it and see. And if you like it, you like it. If you don't, then don't take it.
Okay.
Something else that we can try that I've had good luck with also is using an anti-inflammatory gel, like a Voltaren gel, and just putting it directly on that spot.
I've used the other one. I think I sent it to you. I forgot what it's called, but I have it at home because I had a patient who had like extra, so I just took it from her.
Did it do anything for you?
No, same thing.
It was an anti-inflammatory gel.
Yeah. I think it was like almost like a Voltaren, like similar type of thing, except for it just wasn't exactly.
Didn't really do much.
No, and I did that for a while, like 3 weeks probably, like maybe longer than that.
Yeah.
And nothing, because I was doing that with the Mobic at the same time.
Gotcha.
I think I was doing that since the last time I saw Carrie.
Yeah.
Which was, I think, 6 weeks ago at this point.
Okay. Didn't do much for you. You've been stimming it also, right?
Yep.
And doing that. Does that bother you when you stim it?
No, not at all. I did it over the weekend. Didn't really feel too much in the tendon.
Do you ever stim it while you're doing single leg squats?
I haven't ventured there quite yet.
I was wondering if that would take some of the
Yeah.
offload it a little bit. You know what I mean? Just
Yeah.
as if it would get your muscle activated a little more and take some pressure off that.
Yeah, and I've been trying to work in a lot more like isometric just to get like the tendon kind of to calm down a little bit if it is a tendinopathy.
Yeah.
And I think
It is, Wesley, the way you're describing it and the way you can feel that defect. Like when you get your finger in there when you're at extension, come into extension and just relax your muscle. You can feel here's a defect right here, and that's right where you're sore. So it's just healing.
Okay. Is that weird, the fact that I can manipulate it by just pushing it?
No, I think it just
unilaterally?
feels better because then you load that. You're almost doing what the show pat does. You're basically then loading the good tendon. Here's the good tendon, and here's the good tendon. So if you're going to load it one way or the other, I think you're just taking some pressure off of that.
Okay.
Taping is it's hard to tape it.
Yeah.
Because you know what I mean. It's just the hard because it's so mobile.
Yeah.
That's why I think the show pat strap works a little better.
Okay.
I think it's common. I'm not really worried about it. Like, we have to figure out how do we get it better.
Yeah.
Right.
Yeah. And I'm guessing it probably doesn't help compared to, because I guess the part that's frustrating is the fact that, like, people, we always say don't compare the two sides, but like this one, even though I was 6 weeks on weight bearing, I don't remember having anything like this. Like I remember I was 10 years younger, but even then I didn't feel like I had any issues with walking. And that's the frustration right now, is the fact that every step I'm taking, I'm thinking about, like, oh, I'm going to feel it.
Yeah.
And that's the frustrating part, that I don't know. It just,
Well, so one other thing that we could try is just a lidocaine patch, just a little superficial numbing, and see if that helps you too. Just a topical lidocaine.
Whatever you think is best, to be honest. Like
Because then I think if you can take away that pain and then you can start to walk normally, I think then it's going to be a combination of that lidocaine's not going to heal anything, but it's going to numb that area. I think we try that.
Okay.
So I think we do that lidocaine patch. It's be a little tiny patch.
Okay.
And then we try the show pat and see how that is.
Okay, that's fine.
It's hard to say what it is. I mean, it's a tendinopathy, I think. And certainly it's a tendon causing the pain. But the question is, we're not weight bearing on that side, so probably moves a little slower on it. You're being pretty aggressive on it. I mean, you're doing some great rehab on it.
Yeah.
I think that's what's happening. I mean, I think it's going to bother you, and then hopefully you'll turn the corner in the next couple of weeks and then just be done with it.
Okay. So you don't think it's any type of scar tissue or anything like that right now?
No, I don't. I'm not worried about it.
Okay.
I don't think that it's... I could see you back in a couple of weeks soon, and then we could ultrasound it too.
Okay. Yeah, I used to do this weird thing where I would like almost test my knee. I would like bring it into like a little bit of valgus and just like drive a lot of force. And I used to see my tibia like move before the surgery, obviously.
Yeah.
And I tried it yesterday. I was like, wow, it's kind of nice to not even feel that instability, because I used to feel like it would just like, if I really push it, it would go.
You could actively do it.
So like it feels good, the fact that my ACL like feels good on this side, but
Yeah.
obviously the frustrating portion is the fact that like I haven't been able to like take my rehab to the next level, because I want to like enter that like that early mid phase of rehab to actually start loading.
Start to push it. I mean, the other thing is, Wesley, is the chronic ACLs. The recovery is a lot different, honestly. And you'll probably see that in practice too. But the acute ACLs recover so quickly because they tear their ACL, they get fixed, and then they're like on their way.
Yeah.
But you've had a chronic ACL tear where for 10 years your mechanics of your knee changed to compensate for that. So the rehab is often very different.
Okay.
And I think that's why it's a different experience for you on both sides.
Yeah.
I think your knee looks great, actually. I think, again, you have no swelling. Your knee stability is excellent. Your motion's terrific.
Okay.
We just have to get you over this hump of...
Yeah.
And I know it's frustrating for you, but I think we do this patch. So I'm going to send it into your pharmacy, just the lidocaine patch.
Okay.
And you'll put that on, and the patch, and then you can put the show pad over it.
Okay. Awesome.
So I'll have her just show you the show pad, try it and see if you like it. You can order on Amazon, or you can just get it through us, whatever.
Okay.
Just make sure you get the right size.
Okay.
You want one that's very compressive, but not cutting the circulation off.
Okay, cool. Yeah, that works.
Does that sound good?
That works. Awesome.
Let me have her bring it in right now, then I'll check it out.
Okay, cool.
Thank you for watching today's video. Please feel free to like and subscribe and share it on your social media platforms. If you're interested, I have started an ACL Mastermind group, which is a growing library of content centered around ACL rehab. It has exercises ranging from immediate post-op to late-stage sports-specific movements and everything in between. is a growing library and currently holds over 250 videos. There's content centered around assessments, movement breakdowns, exercise breakdowns, case studies, and a whole lot more. You also gain access to a private forum where you can engage with like-minded people, ask questions, share research articles, and share resources. If you're interested, please feel free to click the link below. Thank you for watching.